Martha.
Hi.
Hi, my name's Diana. I'm going to be taking care of your grandmother here. This is Harriet, I believe?
Harriet, yes.
Yes. So tell me a little bit about Harriet.
She's been coughing up, having a hard time breathing, obviously, and coughing up some pretty thick yellow mucus.
Okay.
She's had a stroke. I've been her care provider for the last 3 years or so. She had a stroke about 3 years ago.
Okay.
So that's been one of the things. She's also has trouble eating because of her dysphagia. So we brought her in today because she's in some trouble. So.
Okay. Well, we did a chest x-ray on her, and her chest x-ray showed that she does have pneumonia there. Was she coughing when you were feeding her at some point at all?
She always gets a little bit choked, but yeah, this particular time, yeah, it's been a few days ago now, but yeah, she did.
Okay.
Little worse than usual.
So she probably got it and aspirated a little bit of her food during this time and wound up with pneumonia. That went right straight down to her trachea and causes some bacteria to proliferate and go ahead and caused her a pneumonia there. We also, which is normal for us, ran a urinalysis there. Did you notice anything about her urine?
Yes, yeah, she is incontinent because of her stroke, and her urine has taken on a smell that's worse than usual. So.
Okay, yeah, it was positive for a urinary tract infection.
That's what I was
There,
afraid
it
of.
had positive leukocyte esterase with moderate bacteria and an increase in white blood cells of 22 there.
Can't get her to drink water.
It's really hard to keep her hydrated. I'm showing with her bun and creatinine, and her bun is 24 and her creatinine is 1.68, showing that she's got a little bit of dehydration going on in there. So that would be part of the reason she's got a UTI also. So my concern is with your grandmother is the fact that she's got pneumonia and a UTI together. Both of these puts her high risk at getting sepsis. Now, sepsis means that bacteria can get into the bloodstream, which is very hard on a patient and very difficult to get rid of there. Right now, we're just monitoring. We did what we call blood cultures, and we're going to wait and see if that has happened to her yet. Okay, it takes a couple of days to get those back. But right now, my concern is her vitals. Her temp is 101.4, so we're going to give her some Tylenol to try and get that down. That's a little high for her. Her oxygenation was 84% on room air, so I've put her on 2 liters of oxygen here, and now she's sat at about 92%, which is good. So we're going to monitor that also for her. The other concerning vital that we have is her blood pressure. Her blood pressure is 89/40 with a mean arterial pressure of 56. And that is a MAP, known as a MAP. And that tells me whether or not my patient has got enough blood pressure to push her blood from her head to her toes there. And she's lacking a little bit there. So we're going to go ahead and start her on some fluids. We're going to bolus her with 1 liter really fast there, and then put her on a continuous IV fluid once we get her up to the floor in there, and hopefully bring up that blood pressure, help the kidneys out, and get those perfused for her. When you're feeding her, I want you to go ahead and sit her up in a 90-degree angle here, okay? Make sure her chin is kind of out. Make sure she's rested just before starting to feed her there, and then I want you to shut down all distractions. If there's a television in front of her, shut that down there. If there's a lot of noise going on that would distract her from chewing, to turn that off for her if possible in there, so that she's not distracted from her chewing, and hopefully we can prevent some of this aspiration. Now, when you choose foods, choose soft foods like scrambled eggs or spaghetti. That would be good for her to chew, and then take just small bites and put it on the unaffected side of that stroke for that dysphagia in there, so that she can use that side and chew on that side for her. We're going to have the speech therapist come out and do a swallow evaluation to see about liquids there. She may need to be on some thickened liquids for her there. And then we'll go from there to see how her eating, how she'll proceed with her feedings there. Okay, we're going to put her on an antibiotic called Levaquin for her once we get her upstairs, and we'll also put her on respiratory treatments, therapy for
Right.
that to kind of help with the pneumonia.
Okay.
And help her breathe a little bit better. Any other questions for my
No, I don't
friend
think so.
Harriet here? Well, Harriet, it's good to meet you, and so we'll get you up to the floor here and get your grandson here some more information about aspiration pneumonia, okay?
Thank you.
You're welcome.